Okay, let's come off of mute. There we go. Live June podcast recording. Thank you so much for being here. I just got off doing a Instagram live with Rosie at Rosie Wellness, Rosie underscore wellness, which is an amazing app geared towards female sexuality. Dr. Lindsay Harper is the founder of that app, and it's amazing, and she's done amazing things. So check that out. It was just on an Instagram live, so I'm sure she'll put it on the Instagram not live thing that follows. I'm such a Gen X. I'm like, you know when it's not live and you can still find it on Instagram? That Instagram TV. All right. So today it's Men's Health Month. Happy June. And so I wanted to talk about this blog post I just wrote again for Rosie Wellness blog. And you can find that. And you can also, my last podcast, I was talking about erectile dysfunction and I was talking about premature ejaculation, but I wasn't talking about Peyronie's disease. So Peyronie's disease is an abnormal curvature of the penis, and it's not a problem if you have a little bit of one, but if it's associated with erectile dysfunction or pain or curvature, greater than 30 degrees is kind of what the researchers used, but curvature enough that prevents penetration, it can really influence and affect sexual function. So didn't want to leave Peyronie's disease out of the top three sexual dysfunction problems for men. There are treatments available. One of the newer ones is it's FDA approved, so insurance covers it. You can get injections. I think it's collagenase injected into the actual kind of scar that you can feel where the curvature is, and it can kind of help dissolve the scar. So just for people who are thinking that they might have Peyronie's or there's nothing you can do about it or anything like that. So I'm going to say hi to Jessica. Jessica, hi.
Well, hello there.
You should promote your podcast right now because it's brand new. You should talk about it.
My podcast called Save Your Own Skin.
Yes, that podcast. I love the name of it. It's awesome.
Oh, thank you so much. I'm honored that you would even think about it right now when you're in the middle of your amazing show.
I am always thinking about you and your podcast because your massive action lately has been like off the charts.
Well, you're my role model.
Ah, you're awesome. Check out Save Your Skin anywhere you can get podcasts if you want to hear about vegan, plant-based dermatologist who has great skin and is aging, not really even aging.
Oh, thank you. Yeah, it's Save Your Own Skin.
Save Your Own Skin.
It's meant to be like a double meaning because it's also about mindset and coaching and how we can get out of our own way in our lives and have total vitality and be anti-aging from the inside out as well as the outside in. So it's Save Your Own Skin.
I love it. I was being sassy to one of my nurses yesterday because I was actually wearing this outfit, which I put on again for my podcast. And she was like, "You always look so cute." And I looked at her and I'm like, not joking. I'm like, this outward, the way I show up outward, it's just a reflection of my inner self. She must think I'm absolutely crazy.
First of all, your inner self is very cute. And also, you're recording this, I know, for your podcast, but I can see you on camera, even though you can't see me, and your skin is glowing and looks beautiful and you look spectacular.
Thank you. I got this new, I've never tried a primer spray, but I get the Ipsy thing and it's like I don't know, it shrinks your pores. Is that a for real thing? I need to ask the dermatologist this. Can I spray something on my face to shrink my pores? That sounds like voodoo.
I don't know, but there are some products that shrink the appearance of pores temporarily. And there are definitely primers that help things look smoother, but shrinking the pores permanently is very unlikely, biologically speaking, since they're really hormonally controlled.
Dude, you know what's super good for your skin? You already know this, but I'm going to tell other people. Not drinking alcohol.
Mm-hmm.
Turns out you look great when you don't drink. They never you never be like, look at heavy drinkers and ever think any of them has great skin.
I have two answers to that. One is that I'm also a lifestyle medicine certified physician. And one of the 6 pillars of lifestyle medicine is to avoid toxic substances, especially alcohol, because alcohol just wreaks havoc on our health in so many ways, including skin. And also, alcohol is one of the direct triggers for rosacea. So a lot of times we associate that kind of a heavy drinker's face with that puffy red look with the red nose and red cheeks. And that's actually rosacea. But not everybody that looks like that is a heavy drinker. A lot of people do have rosacea and get triggered by other triggers, and they get unfairly stigmatized because people see their rosacea and assume they're heavily drinking, but it may not be the case. So I just wanted to say that.
Fascinating. I know that alcohol like breaks capillaries or something. That's why it like makes your skin look bad or red or something.
Right. It dilates those skin capillaries that become permanently dilated. And it also creates kind of this puffiness. Have you ever seen those social media posts about the difference in how people look when they're drinking versus a year later after they've stopped drinking? And it's like
No, but
miraculous.
I want to totally check that out.
It's really miraculous.
Wow.
It really affects people, appearance so much.
I mean, I'm writing this book about stop shitting on your sex life, and I'm to the point. I'm literally writing this book about like people might think it's crazy the thing I'm saying about female sexuality, like women should have equal amounts of orgasms. I'm already kind of being this radical, not really, but I'm like I think I want to put in the book to stop drinking alcohol.
Bold, bold.
Bold in a society that it's on every single end of the aisle in Target, in your grocery store. It's everywhere.
Well, you know what would help is your work in helping people be more comfortable with their sexuality, would help your proposal that people stop drink less, because I think a lot of people drink socially for out of social anxiety or wanting to lower inhibitions. So if you're doing that mind work with your audience from within, then maybe they won't rely on the alcohol so much.
Totally. I mean, I think that working on your sexuality is such an opportunity for personal growth. And I'm like, take it to the next level, stop drinking. You will find some freaking personal growth fast because you realize what you're using it as a buffer for, right? To not feel the feelings you don't want to feel.
Oh, yes, absolutely.
Uh,
I have not actually had an alcoholic drink in almost 2 years. And I wasn't really a heavy drinker before that, but I've really enjoyed not even having to think about it as, part of my life. And it makes me exhausted to drink now. So I'm enjoying not having that cycle going on.
I love it. I don't know if you know that that's my new coaching, like my new coaching thing I'm getting coached on right now is not drinking.
That you're getting coached on?
Yeah, I haven't had a drink in 21 days.
No, but I saw that you were potentially going to be also taking a group of people through
Yeah, super
working on that.
vulnerable. But one of my co-fellow surgeon coaches is like, why don't you do the not drinking? And I'm like, super vulnerable. But I'm like, dude, it is amazing. You want to experience personal growth? Pull that buffer out of your life.
Yeah, I totally agree. I have my own other buffers that are not so productive in my life that I one day will have to face and work on. But kudos to you, and I hope it's an amazing experience.
I think one of the things I'm just, in looking at society and how we get taught about alcohol is like, you don't need to quit. You don't need to quit, or you shouldn't quit unless you have a problem. And it doesn't leave any opportunity for people who are just like curious about like what could be life like without having alcohol in it. Like, you don't have to have a
Right.
problem to stop drinking alcohol. But it's like almost like society has labeled people who don't drink alcohol had a problem with it, and I think that's might be kind of bullshit.
Well, or the real answer is that we all have a problem with it. I mean, not to be too
Yes.
severe, everybody, but there is that now more recent kind of global long range study that put all the other studies underneath it and came out with the result that there is no healthy or safe amount of alcohol, and that any amount of alcohol greater than zero is actually detrimental for us. And,
Yeah.
they hadn't really put that together before so starkly. There was always that, well, one drink a day is healthy for men or women, or one glass of wine. But when you look at the data globally, it turns out that it's actually not true.
Not true. It was that the Lancet study? Was that in the Lancet?
I can't remember
Can't
now.
remember. Okay, yeah, I think that's what I was reading because I was like blown away that why I don't remember learning this in medical school. I'm trying to remember back to like what I learned about alcohol in medical school. Probably just like cirrhosis and then like Wernicke's aphasia, like severe brain damage from really heavy drinkers.
Oh, and I remember that alcohol withdrawal is actually potentially has potentially fatal effects. So people trying to come off of being a really severe alcoholic are actually in danger, and it needs to be done safely.
Right. Yep. That's truth. I was reading a book called Sober Curious, which is kind of one of the books that is going around right now. That and then Quit Like a Woman is also a super huge book for people who are sober curious on like how good can life be without it. I recommend those two books. And she said in the Sober Curious book, she said everybody's a little bit addicted, which kind of goes against society's view of like either you have a problem or you don't. Of like, no, it's an addictive substance because it creates such this huge, trigger in your brain.
Well, when we don't learn how to have fun socially or get through stressful times without turning to that drug, we don't build up the muscles and the skills for doing those things without it. So it's a learning curve.
Totally, yeah. Personal growth abounds. I was watching my kids. I have a 3-year-old and a 5-year-old, and like they're laughing, they're giggling, they're having so much fun without any alcohol. I mean, clearly they're 5, but I'm like, why did adults stop that? Right? It's like our inherent nature just to have fun without needing alcohol, and we just like give that up.
Well, I think we're on this healthier path, I think especially us, we physician coaches are really starting to dig into getting aware of our minds and really helping people from the inside out. So I hope that we're on the forefront, or at least in our little neck of the woods, um, going to be able to spread this message out far and wide and get everybody healthier from the inside out.
Yes, and if you want great skin, cut out alcohol.
Right,
I
right.
know.
It really is one of the 6 pillars of lifestyle medicine. It's its own pillar almost.
And so then it's a big deal. I mean, the economy, the alcohol economy in our country is absolutely huge. Like it's no doubt that why people have such a tough time. It's not like you can just make it disappear.
Well, and we didn't mention this earlier, but of course everybody knows it's the only like truly socially acceptable drug that is promoted and not stigmatized. Even cigarettes now, they're social, they're legal, but people know they're bad. And alcohol is promoted completely differently.
Is weed bad for your skin?
You know, there is a lot of research going on about cannabinoids,
Hmm.
can, cannabidiol and other cannabinoids, and actually potentially benefiting skin in terms of skin disease like acne or eczema, and also potentially anti-aging. In terms of smoking weed or vaping, I don't know that we have evidence that it's good for us.
Yeah.
In definitely in I don't think there's any evidence about the skin. I don't want to demonize it, but I also don't want to promote it inappropriately. I think it's still pretty new. The real science research there is still pretty new.
So pretty new. Yeah, I mean it's legal now in my state, in Washington State, and I think the problem with it is nobody thinks that there's anything wrong with it, and so it's like, oh, just wait, it'll come out. Smoking it's probably not the best, but like the actual chemical compounds using it for medicinal reasons still needs to be sussed out.
Yeah. I mean, I think in chronic pain and cancer, there's gonna be some huge benefits. I hope that for medicating anxiety and depression and things like that, that as a society, we will continue to work on doing as much as we possibly can in the realms of getting to know our own minds, fixing society, and learning more about nutrition and healthy lifestyle so that optional substances like that are play less of a role. That's my hope.
I love it. What are the other five pillars? Can you tell us?
The other 5 pillars of lifestyle medicine are, like I alluded to just now, food as medicine, nutrition, because really we are what we eat, literally. We can control so much of our overall physical health and our mental health and our well-being by our food choices. It's just unbelievable. Whatever we eat is either good for us or it's bad for us. It's either helping us or it's hurting us. And there's really very little in between. We have the ability to control so much of our health outcome by that alone. The second pillar is exercise and physical activity, which you're the absolute queen of, the poster child for. The
Yeah,
third
that
one,
was one of my first mind. I got mind management because of physical fitness, because it's so much about your mind.
right. And, let me just say, as I go down the list of these pillars, that they all interact. And it turns out that when exercise actually affects the balance of our gut microbiome. And the balance of our gut microbiome affects the health of our gut affects our mind and our mental health, because 90% of the serotonin in our body is made in our gut. I don't know if I've said that before, if people know that. People do not realize that so much of our mental well-being literally comes from our gut, and that exercise affects our gut.
Do they know how exercise affects your gut? Is it like, how does that work?
Well, I don't exactly know, but I think it relates to the fact that the gut has its own nervous system called the enteric and the mesenteric plexus. It is almost a completely separate nervous system from the rest of our body. And when we exercise, it affects hormones and neurotransmitters that have an impact on how our gut functions. Beautiful. And on digestion. The third pillar is sleep hygiene and healthy sleep control. I mean, I feel like I'm saying each pillar is the most important, but sleep is the other most important pillar. Sleep is the other most important pillar. Sleep really is like the master program, for our whole body, and also affects our microbiome and our brain function and even our skin health.
Right, and sex, huge for desire.
Right.
If you're sleep deprived, don't wonder why you don't desire sex.
Right. And that ties right into the fourth pillar, which is stress management, mindfulness, and I think of it as the inward facing pillar to our mental health and our stress, and how all these other pillars relate to it. And that ties, of course, directly into sleep and exercise and food. And the fifth pillar is what I think of as the outward facing pillar. It's healthy social networks, healthy social support, which includes healthy relationships. And I mean intimate relationships, and also work relationships, family relationships. That kind of social piece of us as an animal is so important. Also the other most important pillar, because the Harvard Health Study proved that after, 70 years, they came out with the single most important factor in longevity, and it turned out to be the people that had the most robust social support and social networks. And who would have thought, out of all of those things, that your friendships, your relationships, your family relationships, and having that network was the key to everything.
That's amazing. And then number 6 is the toxins.
6 is the toxins, the alcohol, the recreational drugs, and I include there pollution, environmental toxins. And for me, as the dermatologist, I also talk about toxins in our personal care products and skincare.
Like my pore shrinking primer that I sprayed on me today. I'm like,
Well,
it was free.
yeah, there are some people that are really focused on toxins in skin products, and it's not my real focus because I think that that probably plays a relatively minor role in our health overall compared to what we're ingesting and all of the other pillars, but it is definitely a factor. I'm sure your primer is perfectly lovely.
I love how all the pillars really are, again, going back to like what a healthy sex life is. And you got to have sleep. You got to be having your head in a good place. Your relationship needs to be good. Don't drink alcohol. I would say don't drink alcohol. And I think doctors really, going back to that, doctors, people say moderate, moderate, moderate. And it's like if you really want to see leaps and bounds in your health and in your mental health and in your personal growth, you can't have moderate alcohol. It has to be no alcohol.
Yeah, I think you alluded to the fact that I'm plant-based and I am 100% plant-based, but I don't want to scare people off by saying you have to immediately become 100% plant-based to be healthy. So maybe it's like that with alcohol, that society has thought and doctors don't want to scare people off by saying you really have to go without, but maybe we're creeping in that direction slowly, and that's a good thing.
Yeah. I mean, I think even just if people are just hearing it for the first time, and the whole like misperception of like you have to have a problem in order to pull it out of your life. Like, no, you don't. You can just decide not to have it in your life. You're going to have to do some retraining, likely, of everything. But
Well, I've really become an expert at that club soda with a slice of lemon at all social gatherings.
I'm super into ginger sparkling water now.
Ginger. That sounds great too.
It's very, very good. Awesome. Anything else you want to tell us? And then I'll put you back and I'm going to do some Q&As.
Uh, no, but it's always so fascinating to get to chat with you, and I am appreciative of your, mention of my Save Your Own Skin podcast. That's very kind of you.
I'm super excited about it. I'll keep exfoliating and staying away from toxins.
Sounds good. Talk to you soon.
Awesome. Love you.
Love you.
All right, let's go on to some Q&A from the Instagram because there's a lot of good people coming on leaving these questions. So let's go find that now. And thank you so much for Dr. Krant for coming on and talking about, we totally care about skin, even though this is a sex podcast. It has to happen. Okay, so let's go on to our questions on here. Let's see. Because of listening to you, I learned that my problem of I pee just a little bit was because of my loss of estrogen, and she got the estrogen ring. Um, and he has great insurance, and it only cost her $5. That's amazing. You guys, these medications don't have to cost an arm and a leg. Sometimes you have to go on the Good RX. Sometimes you have to change your pharmacy. It's amazing. If you guys don't know this, insights when you're a doctor, but like, if you check out the Good RX app on your phone, you can type in your zip code and you can type in the medication you're looking for, and it'll show you the different prices in the pharmacies in your town or around your zip code. And different pharmacies cost an arm and a leg different than other pharmacies. So like Walgreens is different from Costco, which is different from Target. And it's hard because doctors now most doctors aren't going to give you like the piece of paper prescription that you can like figure it out and walk around with. Like a lot of doctors' offices were required by Medicare to have electronic or what they called e-prescribing. That was actually a Medicare mandate. So doctors' offices switched to that. But so then you have to say what your preferred pharmacy is right off the bat. It doesn't give the consumer any choice to like pick the cheapest option. So on the back end, if you get prescribed a medication, then you can go on the Good RX app and then see where it's cheaper. Then you just call your pharmacy and get it transferred over. That should work. The pharmacy should be able to transfer that over. You shouldn't need to call your doctor's office. Okay, so awesome for that lady. She got $5 estering. And the estering is local vaginal estrogen only. It's not systemic. There is a vaginal ring that is systemic. It's different. But it's only, you have to change it every 3 months. The cool thing about that is for her, it's $5 divided by three. It's like $1 something a month for her vaginal estrogen. That's insane. That is awesome. You cannot have, what else can you buy for $1 a month? It's insane. Okay. I'm excited. Can you tell I'm very excited for this lady? So she has, the reason I'm contacting you is she's had a lot of surgeries, and what does she want to do? She wants some advice about something with surgery, and I can't figure it out, you guys. I think she's worried about post anesthesia side effects of surgeries and she needs another surgery. I would talk to your individual anesthesiologist to see what little amount of anesthesia that you can get then, if that is your worry. I hope I got that question right. But best of luck with your upcoming surgeries. Okay. Oh, I had this story I needed to tell you. So I saw this older woman. She was in her 80s and she was just so thankful that I was a doctor and she was so kind. And she said, she told me the story about when she was 12. So how long ago was that? 70 years ago. She came down for Christmas and there was a Christmas tree and she was in her living room and she started bleeding and it was her period for the first time and she didn't know what it was. She was 12 and she asked her mom what this was and her mom told her it was the curse. And she said that was the start of her sexual education. I think we were talking about sexual education or something. And so that was her introduction to her period, was her mom called it the curse. And then her mom said, and don't get pregnant, because if you get pregnant, we will disown you from our family. And I'm like, you guys, that was not that long ago. And women who get taught that, I don't know what then she taught her child, but like women take that on as fact and then teach other women that. And it's like how, I heard this from an OB-GYN in medical school, is the best way to oppress a group is to have them oppress themselves. And for a woman to tell another woman that a woman, a 12-year-old, that her period is a curse and that she'd be disowned from her family if she got pregnant when she didn't even know how to get pregnant. She didn't even know the logistics behind how would somebody get or not get pregnant, right? So God bless, the words we use can be very, very damaging to people. And it's just kind of miseducation and threats coming at a 12-year-old girl. And that story really, really touched me. And I wanted to be able to remind myself to share that with you and to say we can absolutely do better. We can teach the next generation better. We can choose our words. We can have it not be shame-based. We can give them the education they need to protect themselves. So it's just such a moving story. Okay. So, this person is saying, thanks so much for your podcast. I want to thank you for sharing. I also have a mom who's willing to talk about this stuff. They're going to be in their 80s. See, there we go. They have a woman in her 80s who's happily married and easily talking about sex. So that's super awesome. She says, thank you for being there for us ladies on the verge of menopause. Talk about underrepresented, you guys. Literally, they put menopause underneath the rug after the Women's Health Initiative when doctors just got so scared about estrogen. And now it's 20 years later, and we are just part of the beginning of peeling that back. It's a pendulum swing, and you'll see that in medicine all the time. Pendulum swing, pendulum swing. Remember, I don't know if you remember, everybody was getting breast implants. Then breast implants caused cancer and silicone leakage. Then nobody got breast implants. Everybody got their breast implants ripped out. Then they started doing saline ones, and now people start getting breast implants again. So medicine just is a pendulum for a lot of things, and we're seeing that with hormones. What happened before the Women's Health Initiative is hormones were really the cure-all for everything, right? And they were giving women hormones who maybe shouldn't have even been put on hormones. They were putting women on hormones for primary heart disease prevention, which still hasn't been proven to do anything, especially if you put an older woman more than 10 years post date of last menstrual period on hormones. So certainly using hormones for a cure-all for everything was probably too much. The pendulum swung. We pulled hormones off of everybody, which was probably too much. So now I think we're kind of coming back to the middle ground and saying for the right person, and I would go back to Dr. Krantz' 6 pillars of integrative medicine and healthy living. you have to still do all those things. Hormones are another piece of that if you choose them. I had this lady reach out to me and she was like, you need to talk about the women who can't get hormones because we're being neglected. And I want to honor that, but I also wanted to chuckle and be like, the women who can get hormones are being neglected. Everybody's being neglected. There isn't a more neglected group than everybody at this point. Of the people, of women who are post menopause right now, only 5% of women are on hormones. So I wouldn't say that like just the ones who can't be on hormones are being neglected at this point. We're all being neglected, but it's our job to learn as much as we can, be advocates, be healthy in general, those 6 pillars. Let's see if I can remember them. Let's see. We've got food, we've got sleep, we've got stress, we've got external relationships, we've got alcohol. Which one came after food? Oh, exercise. Yep. Okay, there's the 6. Good. All right. What else can we answer? Um, this is so cool. This is a note from Bulgaria. Hello to Bulgaria. I'm writing to you from Bulgaria. I saw your video on YouTube on estrogen, and I'm excited to try it. I have lichen sclerosis, and I'm wondering if do you think it could help? I'm in my late 30s and I have serious atrophy already. So the lichen sclerosis experts, I know some about lichen sclerosis, but certainly like um, Dr. Andrew Goldstein on the East Coast, Dr. Jill Kraft, who works with Dr. Andrew Goldstein, they're really huge lichen sclerosis experts in America. If you want to check them out, Center for Vulvovaginal Disorders.org. They're amazing. But so what Dr. Goldstein taught me is in these women, the combination of using both vaginal estrogen and clobetasol, which is a potent steroid for to keep the lichen sclerosis under control and managed, is a better combo than just using the steroid because you're going to keep that skin as healthy as possible, and that skin's not going to have like 2 hits against it, both low hormones and the lichen sclerosis. So yes, to my lady in Bulgaria, I think it could help. But again, this is not individual medical advice, and I cannot be your doctor in Bulgaria, but I'm sure it's lovely. It's not bad to ask for it. Um, do, 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 do. Let's see what else we can find. Do I have any recommendations for non-prescription progesterone? Do I? Yes, I do. And then her second question was, is prescription the best way to go? So buyer beware on non-prescription progesterone. You can buy anything on Amazon these days. Well, you can buy anything on the internet these days. But you can buy progesterone. You don't know you're actually getting progesterone. It just might say progesterone on the label. It could also have other things in it too, like estrogen or testosterone or nothing. And the other thing about topical, most progesterone then sold on the internet is some sort of cream, gel, something like that. It's supposed to be absorbed through the skin. The data says the way the progesterone molecule is made, you need a patch the size of a dinner plate in order to get enough progesterone in to protect the uterus. Remember, the only reason people will use progesterone for sleep, but really the only reason that for medical, like FDA approved reason for progesterone after menopause is protect the uterine lining from endometrial cancer. This is what you need to know. When you take estrogen post-menopause, there's a 5 to 10% increased risk of endometrial cancer, which with what we call unopposed estrogen. So if you're not taking a progesterone. The way you can take the progesterone is an IUD, which you can just put in the uterus so it's localized. We think you'll have less systemic side effects of the progesterone then, and oral are the 2 ways. There is no FDA-approved topical progesterone because from a chemical standpoint, you can't get enough of it into your body through your skin, which means all of these creams on the internet that say progesterone aren't protecting your uterus. Have I seen uterine cancer in women who are on estrogen and quote unquote topical progesterone, not FDA approved, internet or compounded? You can also get compounded progesterone, same problem. You don't know what you're actually getting. It's probably not enough to protect the uterus. So have I seen cancer in these people? Yes. That is why the legitimate menopause people really think it's unfavorable to be selling these products for women, because women think they're getting they tend to think they're getting a superior product, right? Because you slap the word natural on it and you slap the word bioidentical on it and you think you're getting a great deal. But it doesn't protect your uterus. You don't want uterine cancer. FDA approved progesterone is the best. So I'd just say stay away from any topical progesterone creams. Remember, you guys, placebo is huge. So people who are like, I'm using it and it's great. It's like, well, yeah, placebo is a legitimate thing. It might be great, but it certainly isn't protecting your uterus. So that is my answer to that lady. Let's see. Let's see. Please do a podcast episode on pelvic floor health and how to make it or get it to be healthy. That's good. And then she says she's been on oral estrogen and after a complete hysterectomy, progesterone added about 3 years ago. I don't know why. She doesn't have a uterus to protect. Maybe she's using it for sleep. Don't know. And also vaginal estrogen cream. She has recurring UTIs. I would make sure it's not compounded vaginal estrogen then and that you're using the full dose. I even have to change this, you guys. I have a video out there about vaginal estrogen where I really talk about using a small amount. I did that video before it became generic, so I was really trying to save women money and to get them to use it. We now know, and my good friend on the East Coast, Dr. Rachel Rubin, will still poke me and give me a hard time for telling women that they can't just use a dab of estrogen. So I need to redo that video. Use the full dose, otherwise you're underdosing. You could be getting recurrent UTIs because you're underdosing your vaginal estrogen. No sex because it's too uncomfortable and you're paranoid. So pelvic floor physical therapist for painful sex. It could be a muscle problem. Again, if you're underdosing your vaginal estrogen, that could be the problem. Next plan of action is to do a pelvic exam and possibly more cultures. Probably it's not an infection, and we like to do cultures once or a couple of times, but start thinking outside the box on so many women and so much medicine, we just think everything's an infection. Everything that hurts is not just an infection. So I would just say I would tell women, I gotta think outside the box on this one. Don't just take more antibiotics. So I hope that helps. I also suspect at least a grade 1 prolapse. That's not a problem. I tell women prolapse is graded on a grade of 1 to 4. I tell women anybody who's had a baby is a 1. You just have more laxity than you did before you had a baby. 4 is your uterus or your vaginal walls in between your thighs. So 2 to 3. 3 is really where women start becoming symptomatic. Some people will be symptomatic at 2. It's very rare that I see a symptomatic 1. Just because somebody told you have prolapse doesn't mean it's a problem. Doesn't mean it has to be fixed. Doesn't mean you're broken. Doesn't mean anything. So I see so many women, again, just for reassuring pelvic exams of like, my primary care doctor told me I had prolapse. Oh my God, am I dying? Is it cancer? And I'm like, well, let's do an exam. And I'm like, yeah, you had 2 kids. You're peeing fine. You're pooping fine. Sex is fine. Do nothing. I always make sure they're on vaginal estrogen and offer pelvic floor physical therapy because that can really help preserve the health of your pelvis going forward. Pelvic floor physical therapy is amazing. If anybody's like job curious, become a physical therapist and become a pelvic floor physical therapist. We need you. We need a lot of you. Our nation's aging. The other thing, since I'm on this, I was talking about job curious with Dr. Lindsay Harper today on Rosie Wellness. Sex therapists. We need so many more sex therapists. So become a therapist, become a sex therapist. There's plenty of jobs. We need like 30,000 more sex therapists. I made up that number. But yeah, you certainly will be plenty busy. Okay, let's see if I can get a couple of more on. Oh, here's another one. Oh my gosh, I have Bulgaria and Pakistan today. This is incredible. Okay, I'm from Pakistan. Can you help? My daughter has recurrent UTIs. I don't want to give antibiotics for so long. She's already given her 3-month course of antibiotics. Okay, so kids with recurrent UTIs, super common. Kids tend to be holders, especially if they're on computers or social media. Life is way too interesting for them to want to pee. They hold it until they're bursting. So timed voiding treatment of constipation is huge for especially kids who are holders. So treatment of constipation is a mainstay. The funny thing about that is like for adults with recurrent UTIs, people neglect to talk about the poop, but you've got to get that fecal matter moving through. Old poop's dirty poop. Get the poop out. But the pediatric urologists really pay attention to bowel health for kids who are getting recurrent UTIs. Timed voiding, plenty of hydration. I'd say a healthy diet, high fiber is good. Anybody with recurrent UTIs, I always like to just get some imaging to make sure there isn't an anatomic defect going on. I have a sister who was adopted, and she was adopted older in life, kind of like age 5, and she was having some urinary issues. This was when I was in medical school. And my mom kept taking her to the doctor for recurrent UTIs. And as a medical student, I was like, have them get a kidney ultrasound. Let's just make sure something's not going on, right? And she actually had an anatomic anomaly that needed surgery. And so I always like to just rule that out. If we're like repetitively throwing antibiotics at people, start thinking outside the box. So if that was available to you in Pakistan, um, just think about it, just to rule out anatomic causes. So I hope that that's helpful. Oh man, Bulgaria and Pakistan in one day. That's awesome. Hey, this one starts, hey, hey, can estrogen protect you from UTIs? Well, yes. Women, postmenopausal women who have very low estrogen have more UTIs than premenopausal women. That's a fact. The American Urologic Association class B recommendation, which means pretty darn good data besides the best data that you can get for research. So class B data that vaginal estrogen decreases the risk of UTIs. Here's a myth. If I go on TikTok, this is gonna be a TikTok. Being sexually active has nothing to do with if you should be on vaginal estrogen or not. And so many women, I mean, just like I just think there's like so much misogyny in that to begin with. I don't know, something about that irritates me. But it's like, I'm not using my vaginal estrogen because I'm not sexually active. And I'm like, what does sex have to do with making your vagina as healthy as possible? Like, does your vagina serve no other function? And the thing is, women don't know that it does serve any other function. So, what the vagina does is it acts as a barrier between the poop and the pee. We want that vagina to be healthy, which means an acidic vagina. An acidic vagina actually acts as a barrier between bowel flora and bladder. So, we want lactobacillus. Lactobacillus thrives with an acidic pH. Lactobacillus actually makes lactic acid, which keeps it a low pH. So the vagina is not just for sex. And every time a woman says, I don't take my vaginal estrogen because I'm not sexually active, I'm like, you're taking it for somebody else. And that's the only reason you'd be taking it, to make your vagina happy. I don't know. I have to work on this a little bit more because it irritates me a lot. And I have to figure out why. Maybe I need coaching on that. Hey, can vaginal estrogen protect against UTIs? Yes, absolutely, it sure can. Okay, let's see. This one's, hey, everybody's saying hey to me today. Hey, I've been watching as many of your Instagram videos as I can get my hands on. I'm so happy to have found you. Thank you. I love you. Thank you for finding me. Um, I was the one who is in her mid 50s and repulsed by sex. You said I needed to see a sex counselor. Yes, that sounds like something I would say. I want them to get underneath that, find out your why, figure out what's going on in there. I have another question. I just watched your May 22nd video about sex and menopause. I've been thinking about trying HRT, but with my health anxiety, I'm petrified about getting cancer. You have helped me realize that maybe I should try HRT. I wanted to thank you. Oh, that's really nice. That's awesome. Listen, you guys, education is never a bad idea. Learn about it, see if it's for you. You can even try it. You can stop it. You can, do all those things. Education's good. I think education really helps with anxiety too, because I think so much anxiety is the fear of the unknown, and educating yourself about that just really, really helps. Okay, let's see if we've got anything else. Here we go. Here's our last one, and we'll wrap it up for the day. Thank you guys so much for joining my live podcast recording. Hey Kelly, I love your podcast and Instagram Live. I find your subject matter absolutely fascinating. I do too. Can you tell? I love this subject matter. Needing quick help. I'm in my mid 50s. Been in menopause for 2 years, feeling pretty good, wanting to get on the estrogen cream, etc. Going to a new gynecologist next month, and want to make sure I have all the info I need. Awesome. This woman rocks. I love you. Look at you. Set an example. Show women what's possible. Okay. Most times I listen to you while I'm walking or driving. Can I just add as an aside, I'm super sassy at 1.5 speed. I'm real good at 1.5 speed. I was just listening to something. I was listening to Russell Brand, going back to the conversation with Jessica and stopping drinking. Russell Brand, who's the British or from the UK actor who's now been sober for a while. He did a lot of drugs. He's really into the sober stuff, and he's like Buddhist and philosophical and really amazing. And I was listening to a podcast that he was on. He was on a podcast on Armchair Expert with Dax Shepard, and he talks so freaking fast that I literally had to like slow. I listen to all my podcasts at 1.5 speed, not Russell Brand. Russell Brand is a 1.0 for me. What that guy says is pure gold. His brain and his command of the English language is insanity. I have to slow it down to listen to it. Okay. Um, can you refer me to what podcast that I did that would have the most information to get my facts straight and come at the discussion most educated and not talking nonsense? Do. I was also diagnosed with rheumatoid arthritis literally as I was coming into menopause. Coincidence? I think not. Any thoughts? I want to live my best life. You go. You're awesome. Um, Estrogen and hormones are anti-inflammatory. They do see more kind of autoimmune inflammatory conditions go up. One of the big things we see with low hormones after menopause is joint aches and pains, which is not always rheumatoid arthritis, but certainly hormone replacement therapy, which Jen Gunter calls menopause hormones. What does she call it? She doesn't call it hormone replacement therapy because she doesn't like the way that sounds. Menopause hormones. Um, has been shown to really decrease aches and pains that kind of come on as a low hormone, as the lower hormones happen. So, yeah, has there been a direct link with rheumatoid arthritis? I'm not quite sure. Heather Hirsch, Dr. Heather Hirsch might know that. I kind of ask her that all the time because I see so many postmenopausal women with rheumatoid arthritis that I think there's going to be more and more information on that. So, no, it's probably not a coincidence. Um, do I have a great Yeah, I have a lot of great podcasts on hormone replacement therapy. So I would just scroll back and look at Heather Hirsch. That was a great one on hormone replacement therapy. Who else do I have on there? I have a great one coming up with Dr. Jim Simon, who is like the menopause guru of the East Coast. That's probably not going to be out for a couple of months. So I definitely have some people in the works. I interviewed a woman who wrote Menopause Manifesto, but I would say this as far as menopause books to go into, Menopause Manifesto, it is a very fair hormone discussion. And then Menopocalypse. Menopause Manifesto is Dr. Jen Gunter. Menopocalypse is Amanda Thebe, Thebe. And neither one of them have been on my podcast yet, but I've interviewed Amanda, so she will be, and I'm emailing with Dr. Jen Gunter, so hopefully soon, so she can promote her book. I love it. Awesome, you guys. Thanks so much for the live podcast. I love this format. Thanks for Dr. Krant again to coming on for me and humoring me and talking about skin and lifestyle medicine and stopping alcohol and living your best life. Love everybody. Bye bye.